Hi, Kinesiology 3030. Welcome to our shoulder girdle lecture. So the shoulder girdle is made up of the scapula and the clavicle, so the shoulder blade and the collarbone. So the scapula you can see here from an anterior view on the left and a posterior view on the right. The scapula is posterior to the thorax or the rib cage. The scapula is attached to the rest of the thorax through the clavicle. So the real only attachment point for the upper extremity to the thorax is between the clavicle and the sternum at the sternoclavicular joint. So this is our real only point where our arm is attached to our body. Then we move out a little bit lateral, and the clavicle and the scapula are attached at the acromioclavicular joint. So the acromion process is that piece most anterior on the scapula, and it articulates with the clavicle to make the acromioclavicular joint. So this joint is special, or this kind of movement is special because we look at it as a system, the shoulder girdle as a system. So we're having movement at our sternoclavicular joint, we're having movement at our acromioclavicular joint, and then the scapula is moving generally against the posterior aspect of the thorax. So our movements available at the shoulder girdle are elevation, where the scapulae move superiorly against the thorax; depression, which is the opposite of elevation, where the scapulae move inferior along the thorax. Scapular adduction is the same as scapular retraction, where the scapulae move medially along the posterior aspect of the thorax, moving the medial border of the scapula towards the spine. The opposite of retraction is scapular abduction or protraction, where the scapulae move laterally and move further away from the spine. So the medial borders are moving around, the scapulae are moving towards the anterior aspect of the thorax, rotating around the thorax. Upward rotation is a combination of elevation and a protraction, depending on how far of a protracted upward rotation it is. This is where the scapula, the inferior angle, so the most inferior aspect of the scapula, rotates outward as the glenoid fossa rotates to face superiorly. This allows us to get our arms up over our head, and then to return to our normal resting scapular position, or even further, we can go through downward rotation, which brings the inferior angles closer towards the spine. So they rotate in towards the thoracic spine. So these are our 6 major scapular or shoulder girdle movements. The joint that's moving here is called the scapulothoracic joint. So how the scapula is moving against the thorax. And we're getting minor movements at the acromioclavicular joint, minor movements at the sternoclavicular joint to allow this to occur. The muscles that create these scapular movements are as follows. The first we'll look at is trapezius. Trapezius has really 3 pieces. There's the upper, the middle, and the lower trapezius. This is all the same muscle, but based on their line of pull and their origin and insertion sites, we'll see slightly different movements. So the origin of trapezius is along the cervical and the thoracic spine, also a little bit against the skull at the occipital protuberance on the occipital bone, and it moves down inferiorly along the thoracic spine, down all the way to T12. So we're getting this movement all the way down the spine as our origin point. So this is the fixed point for this muscle. The insertion point for the upper trapezius is the lateral third of the clavicle. And then for the middle trapezius is the acromion process, and then the spine of the scapula for the lower trapezius. So we have these specific insertion points that dictate the line of pull of that muscle to allow for different movements. So I'll specify here where these fibers are: the upper, the middle, and the lower fibers. Upper fibers are most superior, middle fibers are slightly inferior, the lower fibers are the most inferior fibers on the trapezius. The actions for the upper fibers include scapular elevation. So if we look at the line of pull from the lateral third of the clavicle, moving towards the cervical spine, we get scapular elevation. So the scapula moves superiorly. We have scapular upward rotation. So this can slightly rotate as it brings up. It will slightly rotate the scapula. And then we also see some neck movements. So if the scapula is fixed, so either through other muscles, affixing the scapula to the thorax, or having some kind of closed chain activity with the upper extremity where we are affixing our upper extremity to something stable, the trapezius kind of flip-flops its origin and insertion because the cervical spine and the occipital protuberance are less fixed in this scenario. They become the kind of insertion site. So we can see neck rotation and neck extension, neck rotation to the opposite side. So right trapezius, right upper trapezius will cause left cervical rotation, and it will cause cervical extension. But this is only as long as we fix the scapula either through our muscles or through some kind of closed chain activity where the upper extremity becomes fixed to an external surface. With the middle fibers, we can also see some elevation because they have a slightly superior origin to insertion line. We can perform some upward rotation because that angle, that line of pull will rotate the spine of the scapula to move more parallel towards the thoracic vertebrae. So that will give us a little bit of upward rotation. We can also see some retraction here because there is a lateral to medial line from the origin of the insertion. So we have our three major movements here, moving the scapula towards the spine, moving the scapula superiorly, and rotating through upward rotation. We can also see from the lower trapezius that the line of pull is different compared to especially the upper trapezius and slightly different from the middle trapezius. This line moves from a more superior insertion site to a more inferior origin site. So we're going to see scapular depression here, bringing the scapula down. We're going to see retraction because we have that lateral insertion line. And then we have upward rotation. And then lastly, we have upward rotation so that superior insertion site will pull the spine of the scapula inferiorly, forcing the inferior angle of the scapula to rotate outwards, giving us upward rotation. So trapezius in general performs elevation, retraction, upward rotation, and depression, but only from the lower trapezius. So all of trapezius works together for upward rotation. Upper and middle work together for retraction and elevation, and lower trapezius works towards scapular depression. So now let's start thinking, how does this really apply to our movement? What are some sports, exercises, activities of daily living where we can utilize trapezius to achieve some kind of task? This is your job when you're coming to class. We'll start discussing some of these. So I have these sectioned out for each muscle. Your job is to start thinking of some examples, and we'll go through those examples in lab. For the rhomboids, our next scapular muscle, we have an origin at C7 moving through T5. And then we also see our insertion from the medial border of the scapula. So if we look at the angle of pull, the line of pull from the insertion site on the scapula to the origin site on the thoracic and cervical vertebrae, we see an inferior to superior insertion to origin. We also see a lateral insertion compared to a medial origin. So as we start thinking, what's this line of pull? What might be this actions for the rhomboids? We can see that, hopefully you guessed, retraction, because we have that lateral to medial line. So that's going to bring or draw the scapula towards the spine through retraction. And we can get some downward rotation because we're going to pull that inferior angle towards the spine, downwardly rotating the scapula. And we can also see some slight elevation here. It may be a synergist for elevation to slightly draw the scapula superiorly, especially during retraction. So with rhomboids, we see retractors, downward rotators, and synergists for elevation. Start thinking of some sport, exercise, and activity of daily living examples where you may use the rhomboid muscles. Rhomboids is a group of muscles, rhomboid minor and rhomboid major. They work synergistically together, so we really categorize them together as the rhomboids muscle group. All right, moving on to our next scapular muscle, the levator scapulae. Based on its name, you probably can infer that it lifts the scapula, but its origin site is on C1 through T4, so the upper cervical vertebrae. And then its insertion is on the superior angle medially on the scapula. So we have an inferior insertion, we have a superior origin. We also have a slightly medial to lateral origin to insertion. And we see that angle on the scapula we saw with rhomboids earlier, that having a slight angle. We also saw it with trapezius, having an angle on that pull may cause some kind of rotation around the scapula. So think about how, if this muscle contracts, how would the scapula begin to rotate either upward or downward? So start thinking, what are our possible assumptions? Okay, the first one, obvious, is elevation. So that inferior insertion is going to move towards that superior origin. When it comes to rotation, we're going to get some kind of downward rotation here. So if we lift that edge, that superior angle, medial edge, if we lift that up, the scapula will begin to draw its way towards the spine. It's a synergist for downward rotation. It's not going to be our prime mover, which rhomboid is, but it's going to be a synergist for downward rotation. It's also going to be a synergist for elevation. We already saw earlier, our primary elevator is upper trapezius. Okay, so think about some of those exercise, sports, activities of daily living. What might be occurring when we contract this muscle? What activities can we do that facilitate the utilization of levator scapulae? And now we're going to shift a little bit more anteriorly. So we looked at some posterior scapular muscles. Now we're going to look at some anterior scapular muscles. Serratus anterior is an interesting one. Serratus anterior sits anterior to the scapula and posterior and lateral on the thorax. So really it's underneath the scapula, between the scapula and the rib cage. The origin site is on the costae 1 through 8, or the ribs, costae 1 through 8, in some cases 1 through 9, but 1 through 8 is kind of our general zone, 1 through 9, and on some individuals, there's slight differences compared to your anatomy textbook and what happens in normal people. And then our insertion point is on the medial border of the scapula, but on the anterior aspect. So it's an anterior and medial insertion point and a anterior origin point, like a far anterior with both superior and inferior aspects to it. So thinking back to our scapular movements that we know are 6 scapular movements, and we're looking at where this muscle's origin site is, so anterior on the thorax, and then we're going to the medial border of the scapula, which is the most medial aspect, and the scapula is posterior to the thorax. So what might be some movements that would occur when serratus anterior contracts? If we're thinking insertion point, medial border, origin point on the costae, what might be some actions? First would be protraction. So drawing that medial border towards the origin site. So bringing the scapula around the thorax, kind of this anterior wrapping. This also is called scapular abduction. If we look at these superior fibers there of serratus anterior, if those are going to contract and really pull the scapula forward and up, we can also have some upward rotation. So serratus anterior will cause protraction and upward rotation. Think about reaching your scapula around your body if you're maybe throwing a punch, or reaching out forward to grab something, where you're protracting and slightly upwardly rotating. Also reaching your arms over your head. Serratus anterior will work synergistically with trapezius to upwardly rotate the scapula. So trapezius works on the posterior aspect to pull and control the posterior aspect of the scapula, while serratus anterior works with the anterior aspect of the scapula to give this coordination within scapular movement. So thinking there, I gave you an example of punching or reaching up forward to grab an object as some examples. Think of some more examples for serratus anterior. Where might we utilize serratus anterior in sport, exercise, or activities of daily living? All right, continuing with our anterior theme, we're going to move over to pectoralis minor. Pectoralis minor is anterior compared to the scapula. It has its origin site on costae 3 through 5, so ribs 3 through 5. We have origin sites there. And then we have an insertion site on the coracoid process. Coracoid process is inferior to the acromion process and slightly medial to the head of the humerus and anterior to the glenoid fossa. So it's just inferior to that acromioclavicular joint that we talked about earlier. So thinking here, looking at this muscle, we have our origin site here, inferior on the ribs, and an origin site superior on the scapula. What might be some actions that we can cause to the scapula? So think about that line of pull, bringing that coracoid process, maybe anterior, maybe inferior. So an anterior movement would be protraction. So drawing the scapula anteriorly, bringing that posterior scapula towards those anterior insertion sites on the costae. We can also see depression here because we're going to pull that coracoid process inferiorly because we have an inferior origin. We're going to draw that inferiorly. So here's our primary motions, our protraction and depression. So thinking of this as a muscle, what are some synergist muscles here for depression? A synergist muscle may be lower trapezius. On the posterior side, most of our scapular muscles will have a synergist on the anterior and the posterior aspect. So one will control the posterior aspect of the scapula, one the anterior, because the scapula is really kind of floating in space on the posterior thorax. We have to be able to contract on either side to have smooth movement. And then if we're looking at protraction, we know our other protractor that we just talked about, serratus anterior. So pectoralis minor and serratus anterior both work to bring the scapulae around the rib cage, but serratus anterior is an upward rotator, and then pectoralis minor is a depressor. So they can work synergistically or work in opposition in some cases to neutralize movements from the other. So if we really contract pectoralis minor, we're going to protract and depress the scapula. However, if we use muscles like serratus anterior synergistically, it can help to draw the scapula a little bit more up so it's not only being pulled down and forward. So think about some sports, exercises, activities of daily living for our pectoralis minor and the rest of our scapular stabilizers or our scapular movers. And in lab, we're going to have a deep discussion of really how we can coordinate these muscles. Thanks for watching, and I look forward to seeing you in lab.